Welcome back. It's a worldwide leader in blood research that's improving healthcare, and it's right here in Milwaukee. Versiti is located on the grounds of the Milwaukee County Regional Medical Center, but its impact is being felt around the world. Its research translates into improved treatments for blood cancers and disorders, including sickle cell anemia. Joining us today is Chris Miskell, President and CEO of Versiti. Welcome, and thank you so much for being with us here today, Chris.
Yeah, thank you so much. I appreciate the opportunity.
Many people may know Versiti for the important work it does supplying blood for hospitals here in southeastern Wisconsin. But Versiti does so much more than supply blood.
Yeah, we take great pride in our expertise in all things blood. And there are 5 service lines that we have. The one that most folks know is our Versiti Blood Center of Wisconsin brand, which is collecting, processing, and distributing blood to hospitals across southeast Wisconsin, actually every hospital across southeast Wisconsin, so that they can take care of patients. But beyond that, we have specialized diagnostic testing. We have physician services and physicians that are seeing patients clinically. We have an organ and tissue procurement organization. And then I think maybe part of the discussion today is our research institute. So we think that we like to say that expertise in all things blood really sets us up and differentiates us from other blood organizations in the country.
Well, you are considered a blood research center. Just what does that mean? What does a blood research center do?
Sure. Yeah. So we've got about 28 scientists, and these are world-renowned scientists that have dedicated their lives to finding these answers to complex scientific problems in all things blood. About 80% of them are physician trained as well as PhD trained, which means that then they can see patients on campus, because we're on campus in Tosa there with Children's and Frater. They also have professorships so that they teach at MCW. And so the integration on campus really helps the experience so that we're doing team-based science. Our researchers are focused on all things blood. So it could be anything from leukemia to bleeding and clotting to the safety of the blood supply. We have researchers that look at immunology in the blood, so the immune response that happens. Really, blood, as you all know, it touches everything. And so there's a lot of breadth to the scope of what our researchers do. But they are funded at the highest level from the NIH, which is the government. And so that funding allows them to do great work.
One of the things that's happening in communities of color is that we need to have folks who are in the system. So when someone needs a bone marrow transplant, for example, there are people who are in the system who are potential matches and potential donors. What kind of work are you doing to reach out to communities of color so folks can come into the system and work to help themselves and other people as well?
Yeah, it's a great question. So I'll answer that 2 ways. One of the areas that we support, the organ. So there are 56 federally designated plots of land, I'll call it, across the United States. Versiti has the one kind of in southeast Wisconsin and kind of moving up into the central part of the state. And so ensuring that the organ donation process runs efficiently is something that we take great pride in, because folks are on the waiting list and need those organs. We have folks that are specifically focused on going into communities of color and doing education and kind of helping folks understand that in many cases, folks that look like us wait much longer. The need is higher and the wait is longer to get the organ that's necessary to save their lives. So we've got an entire team that's dedicated to kind of grassroots effort in the community to help with that.
And how is some of that work being done with some of the folks who are working at the grassroots level?
Right. Well, one of the things that I want to talk about is Versiti on King, which you may have heard a little bit about, because this is an area where as a leader in all things blood, we felt like we had a unique place to play here. And so essentially knowing that, 1, not enough folks that look like us donate blood, and 2, not enough are on those organ and tissue registries, we wanted to go from having a more transactional relationship to something that's more intentional. So we're putting it's a blood donation center, but it's also a community resource center on King Drive, and it's set to open in the first quarter of next year. And one of the things that we'll do there is first and foremost have a full-on presence where we're in the community. We're training a lot of our frontline staff that are collecting blood there so that we're active and we're creating a hub and nexus of activity. But also we're doing education. We'll be hiring in the community. We'll be doing education around disorders that disproportionately impact people of color. And hopefully we'll be inspiring folks to understand that people need people. And in many cases, folks that look like us are more likely to provide that match that's so necessary for the patient on the other end.
In addition to perhaps not understanding all of the work that you do around so many blood disorders and blood cancers, the other thing that people don't realize is just how big of a business Versiti is. $400 million a year, that has a huge impact on the local economy.
It does. And we're a nonprofit mission-driven organization. So first and foremost, we're here for the community. And then obviously we're here to have a great experience for our employees. So, the organization started 76 years ago with science and medicine at the core. And it's grown over time across multiple states. About 1,000 employees work in the state of Wisconsin, 2,300 across our entire footprint, which is mostly Midwest with a small presence in Texas. And so we take pride in that economic impact, providing jobs for folks, but most importantly, doing mission-driven work that the community trusts us to uniquely do to save the lives that you love.
And you are getting ready to launch, you're in the midst of launching a big capital campaign, $65 million to expand. What will that allow you to do that you can't do with the current facility?
We're really excited about the expansion and the fact that the governor and the Joint Finance Commission saw the value in the scientific research that we're doing. So the expansion is about 65,000 square feet of space. It'll allow us to recruit more great scientists. It'll allow us to ensure that we've got the right equipment in the building. And then it'll also allow us to ensure that we're building a collaborative environment. Recruiting these scientists is it's high stakes. Because the good ones have a lot of options. And so for us to put a great front forward here in Milwaukee, which we're excited to do, I continue to build on our reputation. We need to make sure that we're competitive in what we're offering them and that the space and the technology is first class. And so this expansion will allow us to do that.
You're leading this incredible organization that is doing so much good work. What advice would you give to other young men of color about what they need to do or what they can do to begin to position themselves for success, just as you've been so successful?
Well, yeah, I appreciate you saying that. I think it's a journey for all of us. I would probably say to folks three things. One, do the work. Two, find mentors. And then three, take on challenging roles and challenging assignments. And so maybe just a little bit more about that. I mean, I think that, on the do the work side, setting a really high bar and operating to your own cadence and your own expectation, setting a really high standard for who you are and what you want to be and what you want to contribute to this world, I think is first and foremost. You've got to find a passion and run your race. But then I'll just say I was really blessed to have a lot of mentors that if you solicit those relationships and you seek those out, people usually want to lean in and help you out. And so I think that for me, helping get direction from folks that have been down the path was really, really helpful. And then the last thing is hard assignments. Yes, not everyone, sometimes there are things that folks are willing to do and not willing to do. And I think that if you're willing to do take hard assignments that are challenging, long-term, those really pay off.
Well, Chris, continued success to you and everyone there at Versiti. We look forward to seeing how you grow and seeing that impact continue even more.
Absolutely. Yeah. Thanks for the time.
Of course. Learn more about Versiti, including how you can give blood during this critical time of the year and save a life at versiti.org. When we come back, we'll see how the Greater Milwaukee Urban League is introducing students to new career possibilities and how that can help improve diversity in the future.